So just to recap, at the beginning of the day, we talked about the importance of screening and how do we reach the sufficient levels of the population. We then explored how do you get all the different stakeholders to work together. And just before the lunch, we explored how do we make this kind of momentum and the effort needed to make it happen? How do we make it sustainable over the long term? This panel, the fourth panel, is going to say, how do we collaborate more and share best practice? And before lunch, there was a lot of messages in saying this is where Europe has a role to play in linking up countries so they can learn from each other and see what they've done. Maybe an opportunity for the EU to invest in population-wide screening methods. And as the EU is just in the process of launching its Beating Cancer plan, it's a good opportunity to explore what we can do to share between different countries to ensure that we are leveling upwards towards the highest performers rather than leaving some countries further behind. So on this panel, I'm going to introduce Professor Dr. Michael Philip Kaminski, the European Chair of the Colorectal Cancer Screening Committee for the World Endoscopy Organization, Professor Dr. Eric van Cutsem, the Head of Digestive Oncology at Leuven University Hospital in Belgium and a member of the board for Digestive Cancers Europe. We also have Valentino Polielas, the Director for the European Regional Health Authorities Network, which is called EUREGA, and Dr. Iris Lansdorp-Vogelaar, who I brought in a bit unexpectedly for her before the lunch break, but she is an associate professor at the Department of Public Health of the Erasmus Medical University in Rotterdam, and here she is representing EUtopia. So let me start by inviting Dr. Kaminski to just give us an insight into where we are. Where do you think we could collaborate best and share our best practices? Professor Kaminski, the floor is yours.
Okay, thank you so much. Thank you for the invitation and thank you for asking me this question. So I think that I mean we should also consider how the COVID pandemic impacted the screening practices, because I think that that really it uncovered some of the problems that were hidden somewhere in the shadows among different countries. And I think that when I thought about what is happening and what are the problems that we are facing and that we should discuss all together, I thought that there is a couple of these problems that we should all together learn about from each other. And the first problem which I was thinking about is, first of all, that some of the European Union countries haven't yet launched the screening programs. This is first problem, but even more emerging one is that some countries which have launched the programs are not achieving the full rollout. And I think that this is something which we should really focus on, how to make it happen that the full rollout is happening, because there is relatively few countries in Europe which have a full rollout of their screening programs. And this is not only because they started relatively recently, but this is because the expansion or the rollout of the program is happening on a quite a long time, or it takes a long time. The second thing that I think that we should think about and talk about is how this how the quality of screening looks like, and how the variation of colorectal cancer screening looks like across the Europe. And I think that some countries made huge progress with that respect, while some others haven't yet started to look at it. And this COVID pandemic further stopped this it's an exchange of experiences with regard to the quality of colorectal cancer screening. And the third thing that we should probably think about is also the participation rate. And obviously there is a huge variation among countries in terms of participation rate. We have Iris here with us, and we know the Dutch program is very successful in terms of participation rates. But still there is, and this is not only that the FIT program is there, because obviously the FIT programs are the the best in terms of achieving the highest participation rates. But we know among different countries that despite having well organized fit programs, the uptake is not good enough. And then there is a problem of uptake of diagnostic colonoscopy following FIT, and this will be further increase this problem with a COVID pandemic. Therefore, I think that we should also think right now in the landscape of how can we move forward right now, taking a maybe some or learning from this COVID pandemic and focusing on those issues which are really relevant.
Thank you. So you've given us, 4 key areas where you think we should be moving forward and to see how we can make progress. Let me now pass the floor to Dr. Erik van Kutsen. You are here in Belgium, but you also are a member of the board of Digestive Cancers Europe. So you also have a little bit of this vision across the different countries. Where do you think there's an opportunity to share best practice and to collaborate?
It's not easier, but I think we have made progress and we are making progress. And the practical organization is indeed done. That's the way it's in Europe on the local level, I mean local national level, and even in some country on the regional levels. And for instance, in Belgium, screening is by law in the community, so the northern part and the southern part, and it's not on the federal, so the national level, and we see big differences even within one country. It was mentioned earlier that we see big differences within Europe. There are also in some countries big difference in this setting, and I think what is important is that we involve in the preparation, and there it's a personalized approach almost for every region or every country, that the different stakeholders are involved in this. For instance, in Flanders, I had the privilege to chair the committee at the ministerial level who had to implement the screening, and we started in 2013. We started maybe a bit later than some other countries or regions, and much later than the French-speaking part in Belgium. But I think we took the time indeed to do it quite well, to have all stakeholders involved, going from payers to patients to those who can do awareness in the program, then to the practical organization, because quality control of all different aspects of the colonoscopy programs, of the testing, of the sending around, of understanding why some people don't participate and don't do. So this practical organization is crucial, involving all the stakeholders. On top of that, what is important also is to work in parallel and together with that on awareness, and there organizations like DICE, and then I put my head as DICE person, can play an important role. One, to increase the awareness. Two, to streamline also over the countries and to come the scientific data and the different models, and there's not one model, but the different models of implementation on some of the practical aspects in this setting. So that's important for DICE, and that reflects also in participation rates, and it was mentioned just a moment ago by Michael that there is a huge difference in participation rate. The Dutch, they have a highest participation rate. They discuss maybe very long before they implement something, but once they're there, then they are good soldiers. Iris can comment on in Belgium, for instance, we have in the Flemish-speaking part participation rates of more than 50%, between 50 and 55, but more than 65% of the whole population of the target population between 50 and 74 is reached, because some of them had already a colonoscopy for one or another reason. So 2/3 is reached, while in the French-speaking part in the country, it's less than 10%. It's just in one participation rate, just in one one region. So working on that at the local regional level is crucial in this regard. That's just some aspects on what we can do and where we should work on in order to roll out the knowledge that we do have with FIT, which is at the European level the most accepted and the best way to do it. And if you do it in a good way, and then colonoscopy after positive test should follow almost automatically if you have a well-organized system where all the different stakeholders do take part. Then the adherence of colonoscopy after a positive FIT will be relatively high. Should be more than 90–95%. There may always be reasons not to do it, but that should be minimal in this setting. In this reach out period or in this preparation, it's also important that we did also in Flanders with the pilot projects to understand how we can reach minorities, immigrant populations who don't speak the national language and whatever in this setting, or for whichever reason more difficult to reach in this setting. Because if you want that at the regional or national level have a participation, then you should good participation should be able to work on the system so that you can reach out to everybody. Also this socially deprived populations, this language deprived populations, let's call it like that, these immigrant populations with different cultures, sometimes in some countries. So to work on that is important, and again, that's going to be the national organizations or regional organizations do play a crucial role, because there are so many differences between Scandinavia and Greece, for instance. Let's go from north to south or from east to west. Belgium and Bulgaria. There are so many cultural differences and so on that are reflected in this system.
Thank you. So again, you've highlighted for us that there's lots of potential for collaboration, because we have these enormous differences within countries and across the EU from one country to another. So this international element of, how do we link to countries here or elsewhere in the world that have somehow managed to increase their participation rates, to get a much more consistent move from the population screening onto the further colonoscopies. These are areas where we all need to share good practice, because there's nowhere in Europe that's 100% really got this right. Let me move now to our next speaker, Valentina, who's going to share experience. Now, your network is, of course, set up to share experience across regions and across Europe. What do you think is the best way to collaborate?
Thanks. Thanks for this invitation, and also thanks to the previous speaker, because I think he anticipates some of the points that I had already, in my speech. So, European regional and local health authorities, indeed, we are a Brussels-based association of 17 regions coming from 10 countries in Europe, and we work mostly on health system sustainability and resilience, just to better understand the context in which we operate. So, for us, this means working on value-based care, outcome measurement, health inequities, digital health, health promotion and prevention, and of course, integrated care and primary care. And those are all topics that we can also translate and fit in the discussion that we are having today, basically. So Euriga has been discussing and working around cancer since 2008 with the Council conclusion on reducing burden of cancer and implementing high quality population-wide cancer screening programs for breast, cervical, and colorectal cancer. So since that time, for my association was really important to really share knowledge and practices, especially around screening. And recently, we've been also taking part in the Beating Cancer Plan consultation. We also released a statement on the Horizon Europe mission of cancer. And again, one of the priorities was absolutely health promotion and prevention. So screening again. When discussing internally, so what is the added value of working together at European level? It's really the need for, I heard that already, to share data, for instance. This is one of the most important things. As I said, we want to ensure health systems sustainable on the long run and resilient on the long run. And in order to do so, we need also to ensure outcomes that are valuable for all the patients and citizens in Europe. And unless we can compare data, it's very difficult also to improve the outcomes. And beside that, another point where my members see a lot of added value in working together at European level, it's one of the points that was actually raised by Professor Van Kutzen before me, and it's around equity, because there are a lot of vulnerable groups that are really neglected and that we cannot reach out through these programs. And for instance, we've been discussing the need of improving communication to reach out those part of the population, of course. We're public authorities, so for us it's really important that we really ensure health for all the citizens, and we believe that, for instance, Europe can do a lot to improve communication around screening programs, also to targeting those minorities and so on. Another point is also improving the services and the implementation of screening programs. So there is a lot that we can do also at European level from this point of view. For us, what is important is to work with an integrated care approach. This is one of the points that I mentioned before, and this is true also for screenings. This is true also for cancer. We need to break a bit the silos between the health and the social care systems in order to ensure that all the actors on the chain are activated and can be part in implementing indeed very good screening programs for everyone. So we need also to, and again, this is a way to reach out, for instance, to those minorities, to those vulnerable groups. We need to be able also to engage with community-based services, with also, of course, with the GPs. I mean, I heard this in the previous conversation that we had with the other speakers and pharmacists. This is really something that we need to improve, and we need to understand from other practices at European level who is doing this and who is doing this successfully. Last but not least, just the last point, it's around education. We believe that, for instance, it's really important to exchange practices to learn how to better train the healthcare workforce in order to implement successful screening programs on the long run. And all this can be done actually through an exchange of practices with European Forum, for instance, such the summit that we are having today. This is something that we should nurture also in the future, where we really need to embed also this regional dimension and discussion, because as was discussed before, a lot is happening at territorial level when it comes to screening. Thanks.
Thank you. Okay, and let me pass to you the last member of our panel before we open up the conversation to the audience, and that's to Iris Lansdorff-Vogelaar. Iris.
Yes, thank you very much, Tasmin, and thank you very much, organizers, for inviting me today to share my thoughts and perspectives concerning best practices from, as I said, a Utopia perspective. For those of you who don't know Utopia, this was a Horizon 2020 funded project in which we tried to improve cancer screening across Europe by providing web tools for screening, monitoring, and evaluation, and by providing interactive workshops for researchers, screening coordinators, and policymakers across Europe. And based on this experience, there are 3 key points that I would like to make. The first one is that from my experience and from the Utopia experience, I see that researchers, coordinators, and policymakers are very willing to share their practices and experiences. In our workshop, we every time had over 100 people participating, and especially that networking and exchange of experience during those workshops among the participants was valued as one of the most appreciative things that they did during this project. So that was really good to see and to know. But second, I think it's initiatives like this consortium meeting that we have today and the Utopia projects that are needed to help connect screening coordinators from the different countries. I think it's quite a barrier for people to make a cold connection, so to reach out to somebody they don't know. And therefore, it's important to get introduced in a certain way. As a researcher, I present my results during meetings, for example, the results of the Dutch colorectal cancer screening program. And at these meetings afterwards, people approach me with specific questions on how we do these, how have you implemented it? And that way I often connect these people to the people at the screening organizations or at the Institute of Public Health to really answer these more implementation-based questions. But of course, I only see the people that attend those forums. So there's a lot of people that are not there and that don't have those connections then. And I think that it's very important on a European level to have some kind of league of screening organizations. We already have it for the screening registries. We already have it for the cancer associations. But I think having regular meetings of the screening organizations would really help improve this interaction and help sharing the best practices across Europe, which I think would eventually lead to improved cancer screening. And that brings me to the last point that I would like to make, because I often hear whenever we have something that we think works well, then people say, well, yes, that works well there or it works well there, but it wouldn't work for us. And I agree that there is definitely differences from north to south and from east to west. But I think rather than thinking that doesn't work for us, I think we should all try and see how we can make it work. So yes, sending out the kit may not work in every country, but then you have Slovenia that didn't send out the kit initially, but at least send out the letter, which you can then fill out for the kit to be sent to your place. So I think that's what we try to do. If there is distrust in the government, I agree. Let's not do a government campaign trying to promote screening, but still the government could fund a campaign organized by somebody else to promote a screening program. And I think that's something that we should try and do, not think about what doesn't work, but think about how we can make it work.
Thank you. You've closed us there on a very positive note to say, you know, there are elements that we could adopt and adapt from different countries. And it's at this point I want to share with you the story of two birds. There's a little tiny bird that's well known for winter. It's called a robin. It's got a red breast and it's a very small bird. It's very territorial, very aggressive. It defends its patch. If you put a little plastic robin in a tree, it will attack it. Then you have a bird, a black and white bird called a magpie. It's got a long tail, and they are very social birds. They are often in groups, and actually you'll find groups that will help co-parent and bring up the babies. So here's the point. You have two different birds. In England, where I grew up, milk used to be delivered to the doorstep in a glass bottle. And of course, the cream rises to the top. Now for the birds, this was an excellent source of fat and protein to feed their babies. So what would happen is we had a thin aluminium piece of metal on the top. And some birds learned how to peck their way through and get access to it. Now, because robins are solitary creatures, one robin learned how to do it, but that knowledge never passed anywhere. Whereas magpies are incredibly social. So very quickly, all across the UK, you could see magpies going and pecking their way through and accessing the cream because the knowledge had spread in a generation across the entire country. So I'm encouraging us to think of ourselves as magpies. If we find a useful piece of knowledge that works from one country, we should adopt it and adapt it for our own. So as you said, Iris, let's not start by what doesn't work. Let's explore where we can go forward and what could be adapted to our own environment to inspire it. So now at this point, I just want to open it up to the floor. We've got lots of comments in the chat, particularly people very excited by some of the elements that people meant here. Let's just ask, you know, what do we need to make this happen? Iris, you said there's a problem, you know, sometimes you need an introduction service. It's not easy to pick up the phone and make a cold call to somebody else. So do we need a platform, an association? What would bring everyone together? The Digestive Cancers Europe have convened this amazing summit that has brought many of the stakeholders together. But where do we go the day after today? Where could we create a space that would allow this to happen? What do we need? Any members of the panel who might want to come in on this? What do you think we would need to sort of create a structure that allows this sharing information, the good practice, this benchmarking, etc. So it isn't a one-off, but it's a continuous process that allows it to happen.
I was wondering if maybe Valentina could respond to that in the sense that she seems to have the experience from a different setting already. The way I brought it, I thought maybe there are already platforms out there, and I think maybe you have to be careful. You don't want to create a platform for just having the platform, but I think if we have a place where we can connect and find each other, then we can transform words into action.
Okay, Valentina?
Yeah, indeed. As I was mentioning, for instance, Eureka was working on this topic since 2008. And in the past, we've been taking part also in the joint actions, for instance, of the European Commission. And one thing that we were discussing today with my members, also in light of the Beating Cancer Plan, it's a bit not to reinvent the wheels, because there are already a lot of good cooperation that at least we can use as a sort of ground in the future. So the idea for us is it's really try to, find a place such, for instance, this summit today, where we can catalyze all these experiences, the experiences that we had with the joint actions, the experiences that we are having internally as an association. But of course, we need a sort of umbrella. And I believe, for instance, this summit could be absolutely be replicated and become in the future really a place where we can get all our speakers and experts involved to really connect and share in a more concrete way practices.
Thank you. Let me perhaps turn to Michael, because we've had some messages in the comments about saying, could we link something to the World Endoscopy Organization's annual Congress? Because Iris from Holland has said that, they had a day before the WEO event, they had a sort of practice and experience sharing meeting, and perhaps this is what they did when it would have been held in Amsterdam. Maybe this could be something that WEO does in the future, is encourages, linked to a day when everyone will be coming together, some kind of process to share experience. What do you think?
Thank you for believing in that. We already are hooked up somehow to 2 other or 3 other meetings in the field of gastroenterology. So we are already hooked up to something, and somebody wants to hook up on us. So we can have this kind of domino style, but it's hope that that not all of us fall. But I think that this kind of summit would be really good to have. We can try to concentrate it maybe around some other meetings like WO meeting, colorectal cancer screening meeting. Yes, this is indeed a very good idea. But when I was thinking about it, just to let the things happen, is that, I mean, when I look at the from the perspective of, let's say, Central Eastern Europe, but probably not only. I also have some links to Scandinavian countries. And I know that the messages that we are discussing between researchers, clinicians, and also some patient representatives, they are rarely coming really through to the administrative and stakeholders. So I think that we should really try to engage them in the process somehow, to let them understand what is crucial, because my experience is that in every single country, because there is, I mean, colorectal cancer screening is obviously somehow like a political thing, and in every single country there is a need or thing that, okay, we'll reinvent it de novo, which is obviously not a good thing, and we should try to adopt it, but we should try to provide what are the already, let's say, verified possibilities to make it happen successfully, and not focus on something which was proven not to work. Therefore, I think that we should really try to engage some stakeholders at the local level and let them understand what we as a colorectal cancer screening community think is the best thing to move forward.
Okay, thank you. So let's just explore this a little bit more. What's the best mechanism to allow this to come become a regular event to exchange these ideas. You know, we've got linking up with big sector-specific conferences and events like the WEO. We've had a comment from Carlo from Italy to say in the EU screening report that shows that a network of health professionals involved in screening could be established just in the same way there is a network of professionals involved in the cancer registries networks. But here's a question. If it's limited to just the healthcare professionals, we're not going to get the kind of multi-stakeholder conversation going that we've got going here, which I think is so valuable. And given that, you know, in the area of screening, it's so much about population and culture and attitudes and behavior, you absolutely need to have this broader conversation with patient groups and others. So let's explore, is there something that we could be doing with a platform that would be perhaps independent or separate that would bring together screening? And should it go just beyond colorectal cancer? Should we be calling for at EU level, and maybe this is something we can talk about in our next panel, we talk about the EU, but should we have all of the screening agencies together who do breast cancer, prostate, colorectal, and whatever else we can now add to that? Should there be a strong platform that would allow exchange across these different disease areas? Anyone want to comment on this? Iris, I'm going to come to you first because on my gallery of speakers, you're right next to my face.
Yes, and I would definitely like to comment on that because I fully agree. I think there's a lot cross disease that we can learn as well. Reaching vulnerable subpopulation is not something that is unique to colorectal cancer screening. It's actually, you see it across all the cancer screening programs. So I would say, yes, we need a cancer screening platform, not specifically a colorectal cancer screening platform, although you could have from plenary sessions, some, of course, parallel sessions where you could focus on single diseases. I think that it would be really good if there would be some regular funding available, maybe on an EU level. That would be easiest to have these regular meetings. And I do want to plug in Carlos' point, because I think when you organize it around monitoring and evaluation, even though you still invite all the stakeholders, I think when you organize it around monitoring and evaluation, it means you also have some results and differences that you can really talk upon. So it helps you see which countries are doing well, and you can sort of approach people from that country to see what they're doing differently, et cetera, et cetera. So I think still, one way of improving programs is knowing how well or not so well you're currently doing. So I think I would still want to plug it around that, but I agree, we definitely need more people involved than just the people that monitor and evaluate the programs.
Thank you. And we've got a couple more points in the chat that are worth picking up on. Stefan has mentioned that there is a thematic network on colorectal cancer screening that he's helping to convene on the European Commission's health policy platform, which is free to join. And so there's, if you like, a specific community that are discussing it. We've had a message from Natasja from talking about Croatia to say, yes, they've got a network of public health institutes, and you even have an epidemiology team who work for the program, but they also have lots of other things that they have to cover. And the screening units sit in different hospitals, which have different capacity in their screening. So, you know, the gaps are further down the system than the upstream bit, which is at the level of kind of national data. So I think this is, maybe this is something that would only become revealed if we had a platform where the information was feeding up, and then we'd see, here are the gaps in these different places. But we are certainly talking about a problem of information management, information flow. So we've had a message from Antonella from the European Cancers Patient Coalition, and she's saying that we need a platform across diseases at international level to exchange good practices. But before we get there, we should have an ad hoc project targeting specific countries where the support is needed. And at the beginning, Dr. Basu showed us some of the data to show the extraordinary range of participation in screening programs and therefore the outcomes that we get. So there's, you know, some countries need an awful lot of support to move forward. We've had a message here from CISA to say in breast cancer screening, there was a network supported by the EU in the 1990s that was very successful in helping to, you know, create a level playing field and allow exchange of information. So members of our panel, keep the comments coming because it's extremely helpful, and we will be saving this chat just so you know when a report of this conference is made, we'll be able to take some of the elements from this and they'll be written in there. So your input is never going to be lost. Members of the panel, do you want to pick up on some of these elements?
Yeah, I think many of the aspects that have been said are indeed correct. And I think you have to approach it not from top to down, not from down to top, but you have to work from both directions. And then, because as I said also in the beginning, there is a wide variation within the countries and between the countries as well in take-up, participation, organization, quality control. And there are some topics that you can deal only in the local region or country. But then there should be on the top also, let's say I think this screening platform within Europe, that should happen. And I think that can be and should be, that's like what we do also in Flanders, cover the different cancer screening programs, breast cancer, cervix, colon cancer, to work on that. But then within, let's say, truncus communis, and then within different, where there can be common learnings, but then with different individual working groups on that, to learn on the experience from the other cancers, but then also to learn on the experience from the different countries, and then to come up with some guidance. Because you remember that the EU recommended, if we speak of colon cancer, many years ago, almost 20 years ago, I believe, to do a screening program within Europe. Europe can only do a recommendation, and Europe can also here provide some guidance on quality control, on ways, on potential different scenarios, and there's not one scenario, but on different scenarios that can then be adapted to cultural and national differences in the different countries. So top down and down top are both equally important. But having said that, I think this European screening platform that should take place, that should be organized, and that can be an opportunity not only to involve healthcare professionals, but also, let's say, payers, politicians, patient organizations, just to name a couple of those are crucial players in the whole game.
Thank you. Michael, I think you wanted to come back on this issue.
Yeah, a little bit. I wanted to raise one more thing that I think it will be very good for collaboration purposes, because the access to data is really essential in order to understand what is happening, to make screening happen. And we all in European Union have a common Gdpr law, but we approach it in different countries in a very different ways, which is really relevant for screening. And I think that we should somehow consider how can we approach it and facilitate across these different countries to have in order to exchange the data, or at least to work on the data and combine data from different registries in different countries in a way that it works across European Union, because we should be able to monitor the quality. We should be able to send out invitations, which somehow in some countries is not possible due to the, I would say, misreading of the GDPR law.
Thank you. And on the issue of the GDPR, which is the General Data Protection Regulation, for those who don't know the alphabet soup of legislation at EU level, the European Commission is proposing a new piece of legislation that they've just announced, which will be a new data governance law that would cover the most important areas of life, and health would be one of them, precisely because the GDPR it's been recognized that there are some areas where in health it's either not working particularly well, or we need better guidance because of the sensitivity of the issue. So that's something to look at. The EU is planning to create a health data space that would focus more on making sure that data is collected more, that it flows more, that it's comparable, more robust. So there's a lot of new developments that are going to come at EU level that I think we'll talk about on the next panel. But I've seen that we've got a couple of more elements that have come in on the chat. People have said, should the screening be linked to prevention, healthy lifestyles and diets? Because if you like, screening is the end result of some of the decisions and lives that people are living. And somebody had said earlier, look, if we want people to go to attend screening in their 60s, we actually have to start preparing by communicating with them in their 40s and 50s, because that's when they've got a chance to change the potential outcome of the screening, and so that it becomes automatic to them that, you know, like they expect their pension to start when they're 65, then they should go to have screening at 60. So there's some interesting conversations in our chat about how screening fits within a broader approach to lifelong health. We've also had some quite strong messages about what Europe should do. Marlene thinks Europe should stop the excuses. Europe is the boss. It could change the way that we work. And again, this is an area that is changing, because previously the European Union has had a very weak legal ability to do work on health because of the way the treaty was written. As a result of COVID-19, we've got the President of the Commission publicly announcing that in 2021, when the treaty is being explored, that we should revise the mandate in health because we need to be able to do more. So I think there's a window of opportunity and a willingness at European level to do something that we haven't seen, certainly in all the time that I've been around at EU level. I also have been working on health long enough to remember when the first cancer screening guidelines came out in the early 2000s, and there was a lot of pushback from member states. The member states who considered themselves to be very advanced felt that Europe was trying to tell them to do things they already knew how to do. Other countries felt it was none of Europe's business to be telling them how they protected their population, or that the standards were being set so high, this was some of the new member states who just joined, that there was no way they could achieve it. So there wasn't a universal welcome 10 to 15 years ago to the Commission putting out standardized guidelines. And I agree with some of the comments that we've had from the audience to say that, you know, the pandemic has changed everything. We can see now that the logic of sharing information and, you know, collaborating helps all health systems to be more resilient. So the window is there of time for us to have the conversation, and we should perhaps push at the open door. We're coming towards the end of our time on this panel, so I'd like to invite each of our panelists to give their last, you know, 1 or 2 sentences on where they think we should go from here. I'll start with you, Michaela. What do you think is the next step? How do we collaborate internationally to raise up the level of quality across Europe?
I think that this kind of summit should be just the first summit that we should try to achieve or to climb. So we should have more summits, and we should try to follow all of them, like the Corona of Himalayas.
The Corona being the Himalayas. Okay, well, the first people who got up were the famous mountaineers, but behind them there were the Sherpas who carried all the bags. So perhaps we could see ourselves as the Sherpas to help move things up the mountain so we can achieve the top of the summit. Let me now turn to Erik van Kutsen. What do you think would be the next step you'd like to see happen?
Yeah, experience sharing at the European level, where we can share and learn on do's and don't do's, and the way that can be done, I think, is indeed from a bigger European level, creating a platform with the different stakeholders, healthcare professionals and healthcare related workers and patients in this setting.
Lovely, thank you. Valentina, what do you see as the next steps?
Well, I believe, this is the right momentum to have this discussion, because we're waiting now for the Beating Cancer Plan that will be soon also released by the European Commission. We know that the Council and the Parliament, they agree also on allocating 5.1 billion euros for the EU for Health program that is going to implement this beating cancer plan. And I mean, this is huge. This never happened before. So the COVID-19 a bit changed the narrative at European level on health policies and programs. So, and plus, as I was saying also before, we also have a mission on cancer. Again, I think also as stakeholders, we need to be smart in getting all these tools together and be sure that we can actually align them and use it for this purpose, for instance, of creating a forum in which we can exchange information. And last but not least, I mean, there is also the willingness to create a European health data space. So it's important really for us to flagship all this initiative with the broader idea of having this cancer screening platform, which is absolutely needed.
Okay, thank you. And finally, Iris, what do you think should be the next steps?
I can totally concur to what's been said before. I think what we need right now, and I hope the next session will show that that might be feasible, is we need long-term dedicated funding to, and it doesn't need to be a lot, but to take the elements of the things that worked in the past, but that were unfortunately short-term, the the European breast cancer screening network that we've heard about. IPAC is in here, Utopia is in here. We have the European Cancer Screening Report. Let's look at what worked well in all of these initiatives, get long-term funding that allows for a yearly meeting and a virtual platform that brings together all the important stakeholders of the cancer screening programs on a regular basis and brings them into contact. I think that's what we need. And hopefully we can find some funding within the Beating Cancer Plan or within some other EU funds that can help this be a sustainable effort.
Excellent. Well, thank you very much, all of our speakers. I think you've given us some very nice, concrete and practical messages to take forward. So I'm going to bring this panel to a close, and I'm going to give a warm thank you to Michal, to Eric, to Valentina and Iris for giving us their insight on where they see the opportunity to collaborate and take forward best practice.